Other than using our own body's defences, we can use drugs to fight disease. Some drugs relieve symptoms, others cure the problem. Painkillers, such as aspirin, are drugs that relieve pain. They don't cure. They don't kill the disease or the pathogen, but help to reduce the symptoms. Other drugs do a similar thing, like cold remedies. They don't actually cure colds. Antibiotics work differently. They actually kill or prevent the growth of bacteria causing the disease without killing your own body cells. Different antibiotics kill different types of bacteria. Antibiotics do not destroy viruses. Remember, viruses reproduce inside your cells, so it's hard to create a drug that destroys them without harming your own cells. These have greatly reduced the number of deaths due to bacterial diseases. Many drugs originally came from plants. You need to learn these examples. Some plants have chemicals that can be used as drugs. Number 1, aspirin, which is a painkiller to lower levels of fever. It's developed from a chemical found in a willow tree. Digitalis, which is used to treat heart conditions, was developed from a chemical found in foxgloves. Others have been extracted from microorganisms, such as mold. For example, the story of Alexander Fleming is an interesting one. He was growing bacteria in a petri dish. He was a messy scientist that always left things lying around. He went on holiday. When he returned, he discovered one of his dishes had mold on it. He noticed the area around the mold was free of bacteria. This mold was producing a substance that killed bacteria. He called this penicillin. He discovered it by accident. Unfortunately, or I guess fortunately, it's not as simple as just discovering a drug and it being on the shelves. There are many stages that drugs must go through to be tested. Drugs must be tested extensively for toxicity, efficacy, and dose. Toxicity means how harmful it is. Efficacy means whether it works, i.e., it does what it's supposed to do. And dose means the concentration that should be given and how often. The stages of drug trials are preclinical phase 1. This is where drugs are tested on cells and tissues. And preclinical stage 2 was tested on animals. These test for toxicity, efficacy, and dose. If it passes these trials, it then goes to clinical trials phase 1. This is tested on healthy volunteers. These test for toxicity. If it passes this, it again goes to clinical phase 2. This is on a small sample of people suffering from the illness. We use this to test for dosage and efficacy. If it passes this, it then goes to clinical trials phase 3, which is a larger sample of people suffering from the illness. These test for dosage and efficacy. If it passes all of these stages, the results are then published in a peer-reviewed journal. This helps to prevent false claims. The trials on humans are done as double-blind trials. This means that 1, the patients don't know if they're getting the drug or a placebo, and 2, the doctors do not know whether the patient is getting the drug or a placebo. This is incredibly important, so the results are not down to bias. You have now learned about how drugs are extracted and the stages they go through to test for new drugs. You will find a summary of this information below. Make sure you test yourself using the quiz on reviseitright.com. Why are we the best revision website out there? Well, because we have it all in one place. Revision notes, summary videos, longer, more detailed videos for topics you're struggling on. exam question walkthrough videos where qualified teachers take you through the perfect answers to exam questions, worksheets, quizzes, computer marked exam questions, interactive flashcards, forums, the ability to keep track on where you are using our tick list, and so much more. But that's not all. We run at least 3 live lessons a week, and closer to exam time, this will be more, where you can tune into a qualified teacher teaching lots of different topics each week. The lessons will be interactive, and we go through exam questions and quick quizzes to ensure understanding as you go. We also run drop-in sessions where you can drop in, ask a tutor anything live, get the answer that you need, and leave. These are included in our silver and gold membership. This means that for an extra £10 a month, you can access at least 12 hours of lessons a month. That's under £1 an hour, which is incredibly cheap. Still not convinced? Try us completely free for 7 days and cancel anytime, completely free of charge. We offer this because we're convinced that you'll love us. So try us now.